All right, guys, we're going to go ahead and get started here. First off, thank you for those who are attending today, and also for those who are signed up to get the recording later. I'm glad you guys all signed up. My name is Dan. I'm a physical therapist working at Reactable Met location, and today I'll be talking about dry needling and sharing with you guys what it is and how it can benefit you in your rehab. So I will go through my slides today fully. I'll try to answer any questions, some common questions we see, and then I will leave time at the end. If you have a question during the webinar at all, feel free to use the chat application at the bottom. And at the end, I'll kind of look through it again, and we can kind of review back. But I'm going to go ahead and share my screen, so I will not be able to see the chat until the end. All right, so dry needling. Dry needling. I took this course this past weekend. I took the course first of two parts. So I learned from the head, the neck, shoulders, and mid-back. So I still the lower extremity, but I did learn enough to kind of give you guys a basic idea of what it is and see if maybe it's something you want to look into and maybe add into your rehab. So what is dry needling? Dry needling is the use of a thin needle that is inserted into muscles aiming for myofascial trigger points. So trigger points are those spots in a muscle, you might call them a knot in your muscle that can be formed due to overuse, muscle trauma, or even stress. So as a result of these trigger points or that tight tissue within the muscle, that tissue in there does not receive as much blood flow, which means it's not getting enough oxygen, right? So, muscles need oxygen to work, to keep on working throughout the day. If you have those trigger points, you're not getting enough nutrients to that region, it's going to result in weakness, tightness, and eventually, if they're in there for long enough, can lead to pain. So what we call, an active trigger point, that's a painful trigger point, can not only cause pain in that surrounding tissue, but can also refer pain elsewhere, depending on how severe it is, right? So for those of you who have had upper shoulder pain, you know that if the pain's really bad, sometimes you feel that it can go down to your shoulder or up into your neck. That is that's that referred pain. All muscles have referral patterns. So for those who have pain, probably have experienced that before. Needles aren't always just inserted in the muscles, but they can also be inserted in the tendons, ligaments, and even joint spaces or right onto the bone. The idea is we're help stimulating those tissues or stimulating that healing process to those tissues or even the joints itself. We're just trying to break up any adhesions in that tissue, whether it's the muscle, whether it's connective tissue. We got to break that stuff up right at the source so that, that tight tissue that's pinching on those blood vessels, it'll free up those blood vessels so that, nutrients and blood flow can get through there. So I'm going to answer this now because I know it's a popular question. How small are the acupuncture needles? So I should have said earlier, dry needling, we use the same needles as acupuncturists. So you can see in the picture, acupuncture needle is about 0.25 millimeters. Dry needling, typically in our course, we actually use anywhere from 0.5 to 0.3. But regardless, you can see two slots up, the hypodermic needle, that says 1.6. Sometimes they can be, I think, closer to 2.4 or 2.5. So typically our needles are about 1/8 the size of a hypodermic needle. So it's a pretty big difference. I think a lot of times people are worried that, you're going to feel that whole needle go in, like when you get blood drawn, you feel it go in and it's very uncomfortable. That's not really the deal with needles. You don't really necessarily always feel it go in, pierce the skin, or even go all the way in. It's when we get to that sensitive tissue is when you start to feel it. So it really depends on how sensitive you are and how much pain you are in. So how does it work? I'm going to go through this pretty briefly. You could talk for a while about, how this works and all the effects it can have. But basically, how we look at it is needling of a trigger point can cause a local twitch response to the muscle, allowing for an analgesic or pain relief effect. So, you don't always get that twitch response in the muscle when we press in there. But regardless, getting in there can stimulate release of chemicals, pain relieving chemicals, opioids, things like that, that can help slow down that pain process. So again, when we get into that trigger point, we break up that tissue so that it relaxes and those constricted blood vessels will open up and more blood can get in there, and blood carries oxygen and other healing markers, so it can get to that tissue and help kickstart that healing process. For dry needling, which is what separates us from acupuncture, is that we won't just always put it into one spot and leave it there. We're actually going to insert the needle. We're going to move it around in a few different places in a few different angles. So we're making sure we break up a few areas in that tender spot. If we just stick it into one spot in a bigger painful muscle, we're running the risk that we're not getting into enough tight spots, right? We want to break up as much of those adhesions as we can. So an example they actually used in the class that I thought was really helpful was an example with the coyote and the roadrunners. For those of you who are familiar with the cartoon, Wile E. Coyote is always trying to prevent the roadrunner from getting somewhere, right? Roadrunner's getting from one end to the other, and the coyote sets up obstacles. He puts, he's the example of TNT. He's trying to stop the roadrunner in his tracks. Think of the TNT as your trigger points, as those tight tissues within your muscle that build up, and they're trying to, not necessarily trying to, but they prevent that blood flow from getting through the muscle, and they're stopping those nutrients from getting to those areas that we need it. And that's what's causing the pain. So I did do a webinar in the past of active release. People use active release, foam rolling, acupuncture, just like that static needling. It just goes into one spot, and it can blow up the TNT. It can break up those adhesions. But depending on how tight it is and severe it is, that might not be enough. So if we're just breaking up a few boxes of TNT, eliminating a few obstacles, the coyote can just always go and resupply his TNT days or even hours later. So by using dry needling and manipulating that needle, we can essentially blow up the TNT, the whole stash, and we can take the coyote with it, right? We're getting multiple areas and we're eliminating the problem. I'm not saying it's, 1 or 2 sessions can solve it. It can, can take 6 or 8 or so on. But by doing this and manipulating the needle and getting a bunch of different spots, we're ensuring that we're solving the goal that we want. So here is an example of dry needling I pulled up on YouTube site. So this is the upper trap. So upper trap is a really common spot that we see where people develop knots. If you grab that tissue, you can kind of see where the needle is. I probably should rewind it a little bit. You already know where it's going. But if you grab that tissue where that doctor or that therapist is grabbing, a lot of us have tender spots in there. And when that gets really tight, that upper trap can refer pain up to your neck, down your arm, down your mid-back, even up to your ear. So, you can massage it a lot. It might feel good for a few hours, but then it comes right back, right? So using this dry needling technique can solve it. So as you can see, before I play it, the doctor, is grabbing that tissue. He's got the needle ready. The needle's actually sitting inside of that sheath. What he's going to do is he's going to press down into the tissue and then pop the needle out of the sheath, which he should do in just a second here. So it's sitting in there. He's going to pop it in. So it's lightly into the tissue, and then he's slowly going to insert it in. So he's just using it as an example for the video. I don't think he does a lot of manipulation of it, but as you can see, the needle goes in pretty deep. Patient there is fine. He's not writhing in pain. The doctor just felt around for a tissue that felt tight, and he's going to pull it right back out. Okay, so that was it. Nothing crazy. If that was me, I probably would have moved the needle around a little bit more to ensure that he's getting all the necessary spots. But again, that's really all it is. So obviously that's just one example. There's plenty of places to needle, but that's somewhere where, moving forward in my treatment, I'm going to use a lot because I do a lot of release to that tissue. So let's get into the, the main part of this webinar is who can benefit from dry needling. Why should you go and reach out to get dry needling? Anyone in pain can really benefit. Dry needling is not for everyone, but multiple studies have shown benefits for a wide variety of conditions. It's just like all other treatments. Some find it very effective, while others do not always see improvement. As far as, the evidence-based research here, specific conditions that have been shown to demonstrate significant improvements are the ones listed below. Tendinopathies, tendinitis, those, your tennis elbow, your rotator cuff tendinitis, Achilles, plantar fasciitis can really be locked into that group. Those overuse injuries of tendons that are doing too much. Your tendon is where your muscle attaches to bone, and that tendon is just getting pulled and yanked on. It's doing too much, and eventually it thickens. That tissue thickens, and then it restricts blood flow to that area. So dry needling, we would go straight into that tendon and the muscles that attach with it to the bone, and we break up that tissue. We decrease the sensitivity of the area, and we get blood flow in. We basically revamp that healing process because it's been deprived of those healing nutrients for so long. Muscle strains, another great example. If you strain your rotator cuff, your hamstring, calf, your neck, sometimes it's one big strain, you feel that muscle pop in your calf, or sometimes it's repetitive strains to your rotator cuff, your neck, where eventually it becomes so tight. That's when those tight bands forms, when your muscles lengthen and then it goes to contract really quick. That's when you can get those tight bands. So we go in there and we break up the tight bands, and that can have pretty quick effects on your pain. Another condition that I found very interesting that dry needling and even acupuncture showed very good results for are migraines and cervicogenic headaches. So cervicogenic headaches is just a fancy word for that your headache is coming from your neck and the muscles that attach from your cervical spine to your skull. Sometimes those muscles get so tight, there's so many knots in them, it's so restricted that they actually refer pain to your head. So for those of you who get pain right in the front of your forehead or in the back of your head, or even around your eyes, there's muscles all around those areas. And if those muscles are really tight, they can cause pain. If your neck's not moving and you have restrictions in your neck, your muscles are going to sense that. Their sense it's not moving, they're going to tighten up and they're going to refer pain up to your head. So, obviously with those areas, we're going to use smaller needles, or at least we did in our class. Other therapists may use some, bigger needles, but we use smaller needles and we didn't go very deep. We just got into those small muscles around your head. And the studies show that it has better effects on migraines and headaches than some pharmacological agents. So I don't know about you, but instead of taking, pills every day, I'd rather, give acupuncture, dry needling a try and seeing if I can get relief in a few, 6 to 8 sessions. And another one I thought interesting was knee osteoarthritis. They found to be beneficial, right? Your arthritis, you're not getting enough blood flow to the knee, to the joint space. Your cartilage is breaking down. By sticking some needles around that joint, maybe even into the joint, onto the bone, we can re-stimulate, revamp that healing process. And it can give nutrients like cartilage and actually cause healing of that tissue and even to the bone. So it can be beneficial in preventing and managing that pain. So what to expect at your first dry needling appointment. So basically, like I said, there's going to be needles that go inside those tight areas. If you have neck pain, we're going to needle around your neck and your shoulder. Due to how thin the needle is, you probably won't even feel the needle going in or as it's pushed in. It's going to be a deep ache once we get to that knot or that area that's really tender. So, some people say, well, it's not too bad. Other people say it's brutal. It depends on how much pain you're in and how badly you really need it. If a twitch response is elicited, you're going to feel the muscle jump. So the upper trap is one where if we put a needle in there, sometimes that muscle jumps. It doesn't actually hurt. It's just kind of unnerving, but it's going to feel better later. Procedures for tendinopathies and plantar fasciitis do tend to be more painful. As you know, for those who have had tendinitis or fasciitis, that area of where the tendon is sensitive. I mean, if you have tennis elbow and you push on the outside of your elbow, it hurts. So obviously sticking a needle in there is going to hurt too. It's one of those things where, maybe I do believe in the no pain, no gain, right? Sometimes it needs that your tissue needs that extra move from a needle rather than just soft tissue massage and mobilization. Your PT or healthcare professional will definitely review your past medical history with you and make sure you're a candidate for dry needling. We're going to have caution with people who have seizures, who are pregnant, who have active infections, vascular diseases, bleeding disorders, diabetes, right? If you're someone who suffers from something like that, we probably will confirm with your doctor to make sure it's okay. The main contraindication really is if you have needle phobia. I'm not going to needle you if you have history of fainting when seeing a needle. So if you're someone who, when they get blood drawn or get a flu shot or whatever, you fainted before, you tend to be lightheaded, it's unlikely we're going to needle you because we do not want you fainting in our clinic. That's for the safety of both of us. So, dry needling isn't necessary. I think it's a great adjunct to rehab, but if you're somebody who's afraid of needles, then no, dry needling is probably not for you. I do want to go over the side effects. It's very brief. There does tend to be drowsiness or dizziness afterwards. Actually, only in 1 to 3%, the studies shown. Drowsiness, I meant to say minor bleeding or bruising is pretty common. 15 to 20%, right? We're going with needles. There's going to be some bleeding. If you're someone who does tend to bruise easily after surgeries or operations, you may have some bruising in the surrounding tissue. But in the studies of, a couple thousand people, it was only in 15 to 20%. Fainting, 0.3%. So, probably only a few people fainted. And then worsening of symptoms is very rare. You have to be aware that, we get into the muscles, there is going to be achiness afterwards. We get into your, if we get into your shoulder muscles or your, your upper trap, I keep using that example, but you're going to feel achiness and afterwards, but it's going to be an achiness as if like, oh, you just got to work out, right? Like that lactic acid buildup feeling. It's not going to be like a sharp pain or anything. It's just going to feel achy for, I think they say anywhere from 12 to 48 hours, depending on how sore you were initially. But it's not going to worsen your symptoms. It shouldn't aggravate it. It's just whether or not you're going to get a good effect from it. So some frequently asked questions that, we ask a lot in the class and, that I hear a lot. Is dry needling the same as acupuncture? Sorta, right? It's really the idea based on why we're going in with the needle. So acupuncture, I'm not going to pretend like I know a lot about it, but acupuncture, the goal is really that, you're altering your chi, you're altering your energy flow. You're going into these specific points, you're placing a needle in, and you're trying to, get energy flow through that area. It's really just a different way of looking at it. It's Easternized medicine. Not saying it, it works, and it's a good way of thinking at it. But as therapists, and we think of a more Westernized version is we're treating it for a neuromusculoskeletal condition, right? We're going in there because you got muscle pain, because you have joint breakdown, you've got nerve sensations. We're going in there to treat that specific neuromusculoskeletal condition. We do use similar points, a lot of similar points. They say they use a lot of the acupoints that they use, but not all of them. Sometimes we just go straight into the muscles that hurt. Other times we base our points off of what the acupuncturists use. And then is it better than acupuncture? Not necessarily. If you're someone who's had acupuncture in the past and it works, that's great. If you're someone who hasn't had either, obviously I think dry needling is better just because of the way we manipulate the needles. But that's not to say it's better. It's very patient dependent. It depends on what you're most comfortable with. Regardless, I do think both options are better for pain rather than pharmacological agents or steroid injections. But obviously that totally depends on your condition and what you're comfortable with. Does it hurt? Yes, it hurts. Depends on how sore you are. If we go into an area that's very sensitive, very tender, yes, it's likely that, it's not going to be comfortable. It's not going to be brutal. Depends on where you're sore. But I don't think it's as bad as people think. I think most, including myself, I don't like needles. I don't like getting needles in me. But I got needles in all the places that we practice on, and nothing was crazy. So it really just depends on how much pain you're in. And do you need a prescription from your doctor to do it? No, you do not. Just like with physical therapy in general, you do not need a script from your doctor. You can come right in for a screen or an evaluation, and we will do your eval and send that note to your doctor. So if you want to get, I think that's my next slide. So when and where can I get dry needle? Give us a call ASAP. We have a certified dry needling specialist at all 6 of our locations. That's at the West Loop, River North, Lakeshore East, Lincoln Park, Wilmette, and Deerfield. We have at least one, most of them 2, that do dry needling. So you do not need a script. If you want to give it a try and talk to one of us about getting dry needled, give us a call and we'll evaluate you and see if you're a candidate for it. Just as a reminder, we're taking all the necessary precautions at each of our 6 locations so that all of our patients feel safe and comfortable. We're wearing masks, we're wiping everything down that's used, not just what the tables, but all the equipment, TheraBands. If we use TheraBand, we're wiping it down immediately. We want to make sure you guys feel safe and comfortable there, and we're being as clean as we can. So I'm going to stop sharing here. Doesn't look like there's any questions in the chat room. If there's any questions that you guys have, feel free to type something in the chat now. I'll give it about 2 or 3 minutes here. But again, thank you for coming. For those, it doesn't look like Ashley's here. She's our marketing rep, but she is, I did send her a copy of my PowerPoint, and we will be getting a recording of this that she'll be posting on our website. I'm not totally sure what the link is, but I'm sure she'll post it somewhere on social media or an email that gets sent. If you have any friends, family who you think may benefit from dry needling and they want to learn some information on it, feel free to send them this recording as well. So it doesn't look like we have any questions. So again, thank you guys for coming. And I look forward to seeing you guys in the future if you ever need us. Thanks.